In this video, we are going to talk about intermittent fasting. What is it and how it affects your body? So before starting this video, please like this video and subscribe to our channel for more amazing content. Weight loss is challenging, but may intermittent fasting aid in the process? This eating pattern, which includes fasting and eating cycles, is gaining popularity as research shows that when it comes to losing weight, it's not just what you eat, but when you eat. Individuals use specified periods of eating, often within an 8 to 10 hour window, to lose weight during intermittent fasting, according to Michigan medicine dietitian Sue Reiskamp, who sees patients at the Frankel Cardiovascular Center at UM. When our insulin levels fall down far enough and for long enough, as they do during a fasting period, we are able to burn off fat, she explains. When a person does not eat, their insulin levels drop. Weight loss is achieved by repeating this practice on a regular basis, similar to intermittent fasting. In addition, this form of fasting frequently leads to a lower overall calorie intake, which aids in weight loss. While fasting, intermittent fasting allows the GI system to rest and heal itself. This is when your body is able to use fat stored in your cells as fuel, causing you to burn fat rather than store it, resulting in weight loss. Recent research findings are encouraging, particularly when combined with exercise and a plant-based diet like the Mediterranean diet. Intermittent fasting may also help to halt the aging process by reducing weight, blood pressure, and cholesterol, according to a Harvard study. Let's start. What is intermittent fasting? Many diets emphasize what to eat, but intermittent fasting emphasizes when to eat. Intermittent fasting is when you only eat at certain times of the day. Fasting for a set number of hours each day, or eating only one meal a couple of times a week can aid fat loss. Scientific data also suggests that there are certain health benefits. Mark Mattson, PhD, a neuroscientist at Johns Hopkins University, has studied intermittent fasting for 25 years. He claims that our bodies have evolved to be able to survive without food for several hours, days, or even weeks. It was easy to maintain a healthy weight even 50 years ago. The portions were significantly smaller. More people worked and played outside, getting more exercise in general. Television, the internet, and other forms of entertainment are now available 24 hours a day, 7 days a week. We stay up later to watch our favorite shows, play games, and communicate on the internet. We spend the entire day, and most of the night, sitting and snacking. Obesity, type 2 diabetes, heart disease, and other ailments can all be exacerbated by eating too many calories and exercising too little. Intermittent fasting has been shown in scientific research to help reverse these patterns. How does intermittent fasting work? Intermittent fasting can be done in a variety of methods, but they all revolve around choosing regular eating and fasting times. For example, you could try eating only for 8 hours a day and fasting for the rest of the day. Alternatively, you could choose to eat only one meal each day 2 days per week. There are a variety of intermittent fasting schedules to choose from. According to Mattson, after a period of time without meals, the body's sugar stores are depleted and it begins to burn fat. This is referred to as metabolic switching by him. Most Americans eat throughout their waking hours, so intermittent fasting is in contrast to their regular eating pattern. If someone eats 3 meals a day plus snacks and doesn't exercise, they're running on those calories and not burning their fat stores every time they eat. Intermittent fasting works by extending the time between when your body burns off the calories from your last meal and starts burning fat. Intermittent fasting plans. Before beginning intermittent fasting, make sure to see your doctor. You can choose a daily strategy, which limits daily meals to one 6 to 8 hour period. For example, you could try 16/8 fasting, which involves eating for 8 hours and fasting for 16. Another method, known as the 5-to-2 technique, is eating 5 times a week. You only eat one 500 to 600 calorie meal on the remaining 2 days. For instance, suppose you decided to eat normally every day of the week, except Mondays and Thursdays, which are your one-meal days. Fasting for longer lengths of time, such as 24, 36, 48, and 72 hours, is not always beneficial and can be dangerous. Going too long without eating may cause your body to begin storing fat, as a response to the lack of food. It takes 2 to 4 weeks for the body to adjust to intermittent fasting. While you're getting adjusted to the new pattern, you can feel hungry or irritable. What can I eat while intermittent fasting? Water and zero-calorie liquids like black coffee and tea are allowed at periods when you aren't eating. And eating normally during your periods does not imply going insane. If you fill your meals with high-calorie junk food, supersized fried foods, and desserts, you're not going to lose weight or get healthier. But what Williams enjoys about intermittent fasting is that it allows him to eat and enjoy a wide variety of things. Eating with others and sharing the mealtime experience, she continues, enhances satisfaction and promotes excellent health. Whether you're trying intermittent fasting or not, Williams, like other nutrition experts, considers the Mediterranean diet to be a solid pattern for what to consume. When you choose complex, unprocessed carbohydrates like whole grains, leafy greens, healthy fats, and lean protein, you can't go wrong. Intermittent fasting can help weight loss. Enzymes in our gut break down the food we ingest, which then becomes molecules in our circulation. Sugar and refined carbohydrates, think white flours and rice, are swiftly broken down into sugar, which our cells need for energy. If our cells don't use it all, it's stored as fat in our fat cells. Sugar, on the other hand, can only enter our cells through insulin, a hormone produced by the pancreas. Insulin is a hormone that transports sugar into fat cells and keeps it there. Our insulin levels will drop between meals if we don't snack, and our fat cells will be able to release their stored sugar to be used as energy. If we allow our insulin levels to drop, we lose weight. The whole point of IF is to allow insulin levels to drop low enough and for long enough that fat is burned off. Intermittent fasting benefits. Intermittent fasting does more than burn fat, according to research. Changes in this metabolic switch affect the body and the brain, Matson explains. Matson's research was published in the New England Journal of Medicine, and it offered information on a variety of health benefits linked to the practice. Longer life, a slimmer body, and a sharper mind are among them. During intermittent fasting, numerous things happen that protect organs from chronic diseases including type 2 diabetes, heart disease, age-related neurological disorders, even inflammatory bowel disease and many cancers, he explains. Here are some of the benefits of intermittent fasting that have been discovered so far by studies. The ability to think and remember. Intermittent fasting improves working memory and verbal memory in adults, according to research. Heart health is important. Fasting for a short period of time improved blood pressure, resting heart rates, and other heart-related parameters. Fasting for 16 hours resulted in fat loss while retaining muscular mass in young males. Mice that were fed on different days had superior running endurance. Obesity and diabetes. Intermittent fasting has been shown to prevent obesity in animals. In 6 small studies, obese adult individuals lost weight by fasting intermittently. Tissue health is important. Intermittent fasting in mice minimized tissue damage during surgery and improved outcomes. Intermittent fasting at a 16:8 ratio has some dangers and negative effects. As a result, the strategy isn't appropriate for everyone. The following are some of the possible adverse effects and risks. In the early phases of the plan, hunger, fatigue, and exhaustion are common. Due to extreme hunger, overeating or consuming unhealthful foods within the 8-hour eating window. As a result of overeating, you may experience heartburn or reflux. Women may benefit less from intermittent fasting than males. Intermittent fasting should be avoided by people who have a history of disordered eating. Fasting is a risk factor for eating disorders, according to the National Eating Disorders Association. Those with a history of depression or anxiety may also find the 16:8 regimen unsuitable. According to some study, short-term calorie restriction can help with depression, while prolonged calorie restriction can have the opposite impact. To fully comprehend the ramifications of these discoveries, more research is required. Those who are pregnant, lactating, or attempting to conceive should avoid 16:8 intermittent fasting. According to the National Institute on Aging, there is inadequate evidence to advocate any fasting diet, particularly for older persons. People who want to try the 16:8 technique, or other types of intermittent fasting should first consult their doctor, especially if they are on any drugs or have any of the following conditions. Diabetes or low blood pressure are examples of underlying health conditions. A history of eating disorders. Mental health issues in the past. Anyone who has questions about the diet, or is experiencing negative effects should consult a physician. What do you think of our video? Let me know in the comment section below. If you enjoy this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.